Becky. I'm your nurse today.
Hi, Becky. Nice to meet you.
Nice to see you. Can I get a chair to
Please,
pull up and get next
please
to you?
get comfortable.
Okay.
Oh, you're going on this side of me? Okay.
So how are you feeling today?
I feel really good.
Okay, good.
You having a good day?
I am. I'm going to start setting things up because the first thing I want to do with you today is take your vital signs.
Okay.
So I'm going to turn on my computer, let that warm up for a second.
Need me to push my shirt up?
Sure, you can get that ready while I wash my hands rather quickly. And then I'm going to set up a little thing to take your blood pressure, see how things are going with you.
Got a big glove. There you go.
Ah, thank you. How have you been doing? Have you been taking all your medications as prescribed?
Pretty much so. I think so.
You've been feeling okay?
Pretty good.
Any shortness of breath or pain anywhere?
Sometimes I have the shortness of breath.
Okay. Do you have any medicines that help you through that part?
I do.
Okay.
I have an inhaler.
Does it help you in that part of it?
Yes.
Okay.
You tell her about the pain in your foot too, honey.
Oh, I will.
Like
I
your
will.
toes lock up on you.
Okay. So let me just put in my password here. While this warms up, we're going to go ahead and start taking your vital signs.
Okay.
Okay. Any kind of new issues you want to bring to my attention?
No, I've been feeling really good.
Okay. Let me go ahead and clean this off with my alcohol.
Okay.
Okay. Do you know where your blood pressure usually runs?
It's been fluctuating a lot, so I've been on some new medication.
Oh, new medication. Okay. Give me 1 second here. Okay. It looks like it's 110/64, and that's in a normal range, so good
That's
job on
pretty
that.
good. My new medicine's working, I guess.
Good job.
I'll have to let the doctor know,
Yeah.
because he took me off one.
Okay, I'm going to listen to your heartbeat for just a second. You have a nice regular heartbeat. That's really good.
That's always good.
Yeah, and in a normal range, it's 72. Okay, go ahead and take a deep breath for me. And exhale. Good job. Nice and clear so far. Very nice. Okay, just sit forward, and I'm just going to lift your shirt
Okay.
and make sure your skin is nice and clean. Very good. No pressure sores noted. Another deep breath. Now I'm hearing a little bit of congestion in your lungs. Have you had a wet cough or anything like that?
No,
Okay.
I don't think so. Have I, Dan?
At
Coffee?
night she coughs.
Okay. Go ahead and take one more deep breath. Perfect.
I'm very dry at night, so sometimes it'll make my mouth is real dry and I'll cough.
Okay, I'm just entering your vital signs here, and I see on the computer that your vital signs have been fluctuating. You've had a low blood pressure here, 70/40, and then at our other visit, we had 120/60, and then you fluctuated down. Do you take any kind of medication for that would help with your blood pressure?
I do take a blood pressure medicine.
Okay, I see it's right here, lisinopril, and it's supposed to be taken every 12 hours. Do you know if you separate it every 12 hours?
I do. I take it at night.
Okay, so what I
So
want you
maybe
to...
it's too long a stretch, huh?
Well, it's supposed to be every 12 hours. So the way I want you to think about taking that medication is if you're going to take it at 8 o'clock in the morning, I want you to take it at 8 o'clock at night.
Oh, okay.
Now, I see you're visibly short of breath. I'd like to take your oxygen reading, but let me check here on the computer. Let me pull it up to see if your doctor, we have an order from your doctor that says we can go ahead and do that.
Okay.
And I don't have one here, so I just have to make a quick telephone call to him and give him a call. And actually, while I am calling him, I would like to see if I could set you up on a home monitoring system called our telehealth. And what that does is the graph that I'm showing you on the computer, the next time I come out here, we'll get your readings every day because you have a diagnosis of COPD. It's important to get your daily weights, your daily heart rate, and your oxygenation status to see if your medicines and your disease are working well together. So I'm going to go ahead and call Dr. Smith right now and get that order.
Dan, look at this system that they're gonna be setting up.
These are her vital signs.
Those are my vitals, and
Hi,
it'll
may I speak to Dr.
Very
Smith?
impressive, huh?
every day.
Great. Hi, I'm here with Vi Walsh. Date of birth is 4/6/42.
42.
And I'm calling to get an order to check the patient's pulse ox. Yes, and we'd like to offer the patient a home health monitoring system that is no charge to the patient while she's on service with us. But this will allow us to get her daily weights, blood pressure, and pulse ox on a day-to-day basis, and we'll only notify the doctor if it's abnormal and her medications are not working. Okay, great. I'll put that down as a verbal order. Thank you. So I'll go ahead and in my computer, open up the problem, and actually get that order in here so everybody knows you're on that.
Awesome.
Okay,
So she used her sleep machine at night?
a sleep machine.
Yeah. What do they call it?
My, what do they call those things you put on your
Is
face?
it like a mask?
Yes.
To help you breathe,
Oh, a
correct?
CPAP.
Oh, yeah, the CPAP.
Yeah.
Okay, I don't even see that listed that we have that in the computer. I'm gonna have to see the machine in just a minute so I can get the correct settings.
Okay.
And probably, looks like your DME company is Apria. So I'll call them to verify the settings that are on the
Okay,
CPAP,
that
as well
sounds
as
good.
put that in here. And you don't use that at night?
Not like I'm supposed to.
No, she doesn't until I wake her up and try to put it on.
Okay, well that CPAP machine is really important. That might be the reason you have some of that congestion and rails in your lungs, is because it forces the air and opens up the lungs. So when you're sleeping, you're actually getting the oxygenation you need. It's
Oh.
so important, and that's why we need to start those daily.
I guess,
Does that make her snore also? She doesn't take it?
No, it'll prevent her snoring, so it's actually a good thing. So I will call Apria when I'm done and just verify your settings are correct.
okay.
And I now have an order to check your oxygenation, so we'll go ahead and do that as well.
Okay.
Now, do you have anything else? I don't have anything listed on the computer in your medications about the breathing treatment you were talking about. Now, is that a
I haven't.
machine or?
I have an inhaler.
Okay. Last time we didn't see an inhaler on there, so when we're all done with this, and I'll have you just write, you'll get a better reading if you
Okay.
put it here. I'd like to see that the inhaler from you, and any other kind of meds that you might have, anything that you buy at CVS that you may not be taking now, but you take maybe when you have a headache. And I don't see vitamins listed on the computer either, and most people take like a daily vitamin or
I don't.
supplements. Okay.
Is that
So-
real?
Yeah, that's real. Your oxygenation is 92 and your pulse is 68. So it's within normal limits and
Is it?
right where it's
Okay.
supposed to be. So good
Good.
job on that.
Good.
She's normal?
So can you go ahead and get the inhaler?
Sure.
And can you guys think of any other medications that I don't have listed on here?
I have an Advair that I
Okay.
use. And my messy purse here,
That's okay. I will go ahead and add this on the computer.
my sea bag,
And do you take this
I
once
have-
a day?
twice a day.
Twice a day.
Kind of sloppy with it though.
Okay. It's so important to clear out those
I know.
lungs for you. I'll take that other one. Okay. And how many times a day do you take this medication?
I don't take that unless I need it,
Okay.
which is probably.
Right now, right?
Probably. Inhale 1 puff by mouth 4 times daily as needed.
Okay.
So,
So since you're a little short of breath right now, I'd love for you to show me how you go ahead and take this medication.
make them.
Yeah.
Okay. Shake it really good. I have to take a deep breath.
Very good.
Good.
And When was the last time you took this? Did you take it already this morning?
No,
Okay,
I
because
didn't.
we should probably do that too, since it's time.
Okay, I can do this real.
Okay.
Okay. There we go.
Excellent.
Is
And-
that good?
You did great, and I'm just
I
gonna.
need to have a little water. because it's supposed to
Exactly,
not-
that was my
It's
next.
supposed to be,
Yeah, you want to
Rinse.
clear it out. If you don't, you can get infections and. Okay, so I am just actually quickly going to chart down that you did a correct return demonstration for your
oh,
inhalers.
good.
So I'm just going to put that on your chart, so if the doctor ever wants to know, we can say that we observed you doing your inhalers correctly. Now the key is once we usually get this home monitoring system, which someone will explain to you, set up in the house, we usually only need to see you once a week because we monitor you on a daily basis. But I know that we have a little lack of information that we need to share with you regarding your disease process.
Okay.
So I'm going to share with you, which I did bring in because I did know you had the COPD, is our COPD packet.
Oh,
This is a
okay.
great tool for learning, if I can go ahead and get it open.
There you go.
There's some important information on here that I'd like to share with you. And one of it
Have a seat,
being
Dan.
is the chronic obstructive zones. These are really important. The green is always where you want to be. And yellow is a warning sign. And I'm going to fill in these doctor's numbers and go over it a little bit further. But red is a 911 phone call. And these are all signs that your symptom is having a flare-up when you're in here. So if you have an increased amount of sputum, if you have increased cough or wheezing even when you take your medicine, or an increased number of quick relief medicines. Your quick relief could be your inhaler that you use when you're just short of breath.
Right.
So like right now, how are you feeling after doing that?
I feel good.
You
I
feel a lot
open.
better?
Yeah.
Okay, so that's a good sign.
Right.
We need to avoid your hospitalization, okay?
Right.
These COPD can get you in the hospital and out of the hospital on a regular basis. Our job in home health is to prevent you from going back in. So we want to keep you always in this green zone. So we'll need your daily dry weight. And what that means is first thing when you wake up and you use the restroom, jump on your scale. And we'll provide one for you with this home health monitoring system.
Okay.
And then we'll want you to do your O2 sat. And then we'll write that down as your baseline.
What is the O2? Is that?
That's
what's
this
the-
monitor right here.
That we, oh, okay.
Correct.
Okay.
And I'm giving your medicine a few minutes to work, and we'll see if we got that 92 up to a higher level.
Oh, okay.
So we'll go ahead and check that out right now. Okay, and then go ahead and put that there.
Will
So,
this clear? Oh, okay.
So the yellow zone is where you want to make a phone call to us or your respiratory therapist or your doctor.
Oh,
Okay? So if it's during the day, we like a phone call to us because sometimes we can come out and listen to your lungs, troubleshoot with you. If your O2 sat is down and your meds aren't resolved, we'll have an alert. Okay? If you're ever short of breath, you can use this again, and it will notify us that you're having some problems or call in.
oh,
Okay?
wow. Okay.
Do you know how to get a hold of our agency?
Yes, we have the phone number.
Okay, and it's also right here.
Oh,
I
good.
always tell people, put this on your refrigerator. Sometimes you don't feel good, you're sleeping with more pillows, whatever it can be, a weight gain, a small fever. These are all little signs you need to notify us. Now look at this. Your
Oh.
oxygenation went up to 94 from 92.
It did go up. That's awesome.
So that just proves your inhaler's working for you right now.
That
Great.
red zone, is that when you call on the mortuary?
Yeah, no, red zone
No,
is
not asking.
You know, I married a comedian years ago.
the red zone is we need to see you now, or it's a 911 emergency room visit. We want to avoid this altogether, so let's pay close attention. I'm going to give you guys a little homework. Let's read pages 1 through 4, and our visit tomorrow, we're going to follow up on that. And if you have any questions, we'll go over it at that time, okay?
Sounds great.
So I'm going to add a couple more visits to see you. Now, your husband said something about foot pain in your feet.
My toes are kind of, they lock up on me sometimes, just
Okay.
out of the blue, and I
They
have
like
to,
cross over and
and they hurt. But they hurt even worse when they release.
Okay, so I'm going to start to take off your shoe, and I just need to know real fast if you're a diabetic.
No, I'm not.
Okay, I didn't have it on your
No.
your sheets, but
Do you need
it's
this?
a good thing to know.
No.
Oh, I'm so sorry.
Scratch.
I'm gonna take that for you as I get my gloves. So I'm gonna take off your shoes and I'm gonna look in between your feet and toes and make sure that there's no sores. And then tell me a little bit more about your pain. On a scale of 0 being no pain at all and 10 is like being run over by a truck.
When it happens,
Where do you rate your pain right now?
oh, I'm fine right now. I'm
Two,
one.
zero-
Yeah,
a 1 out of
0.
10.
Yeah.
Now, do you take any medications to help you relieve the pain in your feet?
No. Twist, and then they stay that way for a while, and there's really not much you can do, and then it'll finally relax. Hurts really bad, and then it just
How
eventually
bad on that
releases.
scale?
Oh,
of 1
I'd
to
give it
10?
a 10.
A 10, okay.
And then, but there's like, don't touch it, leave it alone, and then it'll release. But it's like at a 10 for a little while, and then it's gone.
Do you take any medications
For
while
that,
happens?
no.
Okay, so you have a 10 out of 10.
It's kind of a
pain?
short, it just
Short.
happens,
Okay,
and then once it's done, it's done.
okay. Tell me a little bit about your diet.
Well, I don't know, probably don't eat the right things, or,
Okay, are you
Right.
eating 3 meals a day?
yeah, or sometimes just 2. If
Okay.
we eat late in the morning, then I'll just eat dinner.
Okay. And then, are you snacking throughout the day?
Not like I used to. I used to be a grazer, but I'm not so much anymore.
And what would be a typical diet for you during the day?
This morning we had some waffles, or it could be an English muffin.
Okay.
Sometimes an egg.
Mm-hmm.
If I get hungry, maybe a half sandwich for lunch.
And what kind of sandwich would you have? Would you have lunch meat on that
Yeah.
sandwich?
Or it could be tuna. I
Okay.
like tuna with crackers.
Okay.
And then we usually always have a good dinner with vegetables and a
Vegetables.
potato and a meat.
Fresh, or is this something you're cooking or something you're reheating in a microwave?
No, we're cooking,
Okay.
because we still have a full family at home.
Okay.
So we cook like fresh potatoes and vegetables and meat.
The next couple questions are going to give me an idea about your electrolyte imbalance and hydration. So, what color would you say your urine is on a day-to-day basis?
Pretty clear.
And today, this morning?
Clear
Okay. And your last bowel movement?
this morning.
Okay. And was it normal for you?
Yes.
Okay. Give you any numbness and tingling in your toes ever?
No,
Sharp pains?
just when they lock up.
Okay, so other than when they lock up, which is a 10 out of 10 pain, I'm going to have to notify your doctor about that because that's way out of the normal.
Yeah, when it happens, it hurts.
Okay, so
It hurts.
I keep
It's-
telling her I'll step on him and break a loose for you, honey. but
do
she
you
won't let me.
see do you
It's so
see a
good to me.
podiatrist at all?
No.
No. And have you ever told your doctor about this pain?
I have told him, but it doesn't happen like that often, or,
Okay.
and sometimes, I could be wiggling my toes like this and it'll happen.
Okay. And have you ever had any other pain similar to that anywhere else in your body?
No.
Okay. So I will notify your doctor about that. When it happens, you say the pain lasts about how long?
Could be a couple of minutes, it'll stay locked up, but then afterwards it'll be another couple of minutes of just, I would say sometimes the pain's worse after it unlocks.
Okay.
So maybe the pain's an 8 when it locks and a 10 when it unlocks. It's almost like this horrendous bruise.
And then how long does it last about an 8?
Just another couple of minutes and it's
Okay.
gone.
So I'm writing all this down in your chart, and currently your pain is 0 out of 10. The worst in the last 24 hours is 10 out of 10 with the toes.
If it happens with the
If
toes,
it happens. Did it
yes.
happen last night?
No.
Okay. When was the last time it did happen?
Oh, I'm gonna say a week or so ago.
Okay.
It's
I'm
not,
still going to let the doctor know
Okay.
because this is new and abnormal for you and they're not aware of it.
okay,
So he might refer you to another physician or want you to come in and see him.
okay,
Okay? So I'm going to listen to the bowel sounds.
okay.
Okay? So I'm just going to lift up your shirt
My tummy.
and listen to your tummy. And then I'm gonna pull your pant down right here just so I can get right on your skin, and you've got great bowel sounds, which
Okay.
I thought you would because you have daily bowel movements. Okay, do you wear glasses at all?
No.
Oh, okay. Let me just check the rest of your arms. This is the first time I've seen you, and in your chart it says that you don't get up and walk around that often. So we'll go into a separate room and I'll check your behind just to make sure you don't have any bed sores or anything like
Okay.
that. And I would like to add a couple more visits onto you to educate you further about your disease process. You know, we really should be avoiding lunch meats that are high sodium. Maybe we can
Right.
choose better choices at lunch. And then I will follow up with your doctor regarding your pain, and we'll see you tomorrow.
Sounds great, Becky.
Okay, it was so
Yeah,
nice to meet
too.
you.
Thank you so much.
Thank you.